Hi, Aliria. How are you?
Good, good. How are you doing?
I'm good. It's great to see you. Haven't seen you in a couple of months.
And you as well? I know it's been a while.
For sure. So, we wanted to chat with you a little bit today because you created this new course. It's a CPE course for registered nurses. So, if you would tell us a little bit about what the course is, and definitely just as importantly, what the course is not.
Sure. So this is a course, like you said, for registered nurses who are working but not working in the ICU. And in light of the pandemic, there's a greater need for, excuse me, for nurses to be working in the ICU that maybe are not familiar with that environment. So this course helps support them in that transition. To answer your question about what it is not a comprehensive orientation to everything about the ICU, but it also isn't a narrow mechanical ventilation, which is very common in a lot of the free courses that have been offered. There's been kind of this narrow bullseye focus on mechanical ventilation, and this course provides not only support for understanding how to take care of a patient on a mechanical ventilator, but also what does it mean to be an ICU nurse? What other knowledge might you need?
Okay. And if you would tell us a little bit about how this course came to be. You obviously have extensive ICU experience, but who approached you? Because you're working with Ed Plus or ASU Online on this course. So, how did this all sort of come to be?
So Andrew Nelson, who's actually the program manager for strategic network advancement, contacted me, and we just started off with a chat of what might be necessary. His team was trying to look and see how can we support healthcare workers in this crisis, what's already out there, what's not already out there, and there, like I was saying before, there is a lot of free coursework out there, very narrowly focused maybe on COVID or very narrowly focused maybe on mechanical ventilation. And thinking about when I very first started working in the ICU, those are such small areas of expertise that when you clock in and you're about to go work in the ICU, you need a lot of other knowledge and a lot of other information to really be successful. So thinking about my critical care experience, I started off working in medical ICU, and I basically worked with patients who have a lot of comorbidities, focusing on pulmonary hypertension. I cross-trained in the trauma ICU, surgical ICU, neuro ICU, CV ICU. I worked as an agency nurse throughout the valley in different ICUs in Phoenix. And pulling from those experiences, but also having taught critical care at ASU, it was really helpful to kind of take a step back and think of that nurse that is about to work in the ICU that needs that support and what kind of information they need. So, I had to look at materials differently. I couldn't just take the course I teach our BSN students and turn it into a course for registered nurses. It's a very different audience. So there was a lot of upgrading. There was a lot of review of the recent literature to really help prepare them as practicing nurses moving to a different environment.
Right. And you mentioned this already, but the context of all of this is that obviously we're in the midst of a pandemic. And so you have a lot of nurses who, I believe the industry term is, are floating to other units. So these are nurses who are not familiar with perhaps working in these ICU settings. So maybe just kind of describe the need and the context. And we know that there's a need because more than 800 people have already registered for this class.
Actually pushing on over 1,000 now. And we have just to kind of, yeah, like you said, give an overview of the course. So there's 7 modules. We start off just introducing the nurse to what it means to work in the ICU, review of respiratory systems, a review of mechanical ventilation. I created a new module on just COVID and how do you take care of a patient with COVID in the ICU. We go into EKGs, hemodynamics, shock. So it's the idea is, again, to support this nurse transitioning into a new environment. But one thing that we identified that is lacking out there with some of the other similar types of courses that maybe just focus on mechanical ventilation, or what is really needed, is when you're faced with a clinical situation where you can't Google it, you can't learn it from a course, it requires expertise. And so we added a module or a feature in the course called Ask the Expert. And we recruited practicing, actually ASU alumni, BSN prepared nurses with more than 2 years of ICU experience to serve as experts for when these nurses are faced with a situation that, again, you can't really look it up, and they really, want to seek out the knowledge and expertise of practicing ICU nurses. So that's a unique feature of our course that I'm really excited about, and I think is really important.
That's fantastic. And to be clear, this is a self-paced online free course. I just want everybody to know that this isn't something that is for credit or anything like that. But how important was it to make it free and to make it self-paced? I feel like that really plays to the accessibility.
Absolutely. I mean, you have nurses working night shift, working day shift, working overtime, different time zones, and with different availability with kids at home. So, yeah, it needed to be self-paced. There's recorded videos in each of the modules. There's activities in each of the modules. So, yeah, I think that's very important that it's also free as well. People are struggling right now. Early on in the pandemic, a lot of our nurses were being furloughed as well. So not everybody's feeling very financially secure at this moment too. So when we respond to a crisis, I think making the course free is really important.
Okay. And finally, one more thing. I know that this was a personal kind of passion project for you as well, because you wanted to be able to support your colleagues and you're not able to be on the front lines yourself, so to speak. So do you want to just kind of share a little bit about why this is so personal to you to be able to create this course for your colleagues?
It makes me think to the nurses' social contract with society. All nurses have an innate desire to help their community, and we are obligated to help society. And it doesn't always look like a bedside nurse doing what a bedside nurse does. This was my way of giving back to my fellow nurses, thinking about them, in the environments that they're in right now. And I always say it's one thing to talk about a situation and learn about a situation, but it's a completely different experience for what it is like to clock in and take care of these very sick patients in these conditions. So this was one small way I could contribute, and this is what I do. This is where I have expertise. This is where I have information and resources. So the really nice thing about this was, even though I poured my heart and soul into this and I really wanted to support my fellow nurses, the team that I worked with, the instructional designers and the people from Ed Plus as well, were just as excited as me, and they've never been at the bedside. And so it was really exciting to see how, just as human beings, we want to help each other in whatever way we can. And it was nice to be able to contribute to that.
Well, it's such a fantastic course and such a great idea. And I know that nurses in our community and even around the country are so grateful for it. So thank you again for doing what you do and also for joining us today to chat a little bit about it.